How to interpret lab result trends for your health. Understanding lab result trends is essential for anyone, especially for those who have survived cancer. Monitoring these trends can help you stay on top of your health. It is not just about one single test result but how your values change over time. This can give you and your healthcare team a clearer picture of your health status. Each lab test measures specific substances or cells in your blood or other samples. These tests have established normal ranges based on healthy individuals. When you get your lab results, it is important to look at whether your values fall within these ranges. However, what matters more is how these values change compared to your previous results. For example, a complete blood count measures red blood cells, white blood cells, and platelets. If your white blood cell count is decreasing over time, it might indicate that your bone marrow is not functioning well. This can happen due to past treatments like chemotherapy or radiation. Another important test is the comprehensive metabolic panel. This test looks at your liver and kidney function, blood sugar, and electrolytes. Changes in these values can signal issues with your organs, which may be related to treatment side effects or other health concerns. Tumor markers are substances that can be elevated in the blood when cancer is present. After treatment, monitoring these markers can help detect any recurrence. For instance, prostate-specific antigen is tracked in prostate cancer survivors. However, it is important to remember that these levels can change for reasons other than cancer, so trends should be interpreted carefully with your healthcare team. Other routine tests, such as albumin and C-reactive protein, can provide information about inflammation and overall health. Changes in these values over time may indicate complications or the need for further evaluation. When looking at your lab trends, start by comparing them to your own baseline. Your normal values may differ from population averages, especially after treatment. Tracking your results over time allows you and your healthcare team to identify meaningful changes. Always consider the clinical context. Lab results should be interpreted alongside your symptoms and physical exams. A single abnormal value may not be significant, but a consistent trend might require action. Communication with your healthcare team is key. Discuss your lab trends with your doctors or nurses. They can explain what changes mean for your specific situation and whether any interventions are needed. Lastly, be aware of the limitations of lab tests. Some tests can produce false positives or negatives, and not all health issues are detected by blood tests alone. Lab results are just one piece of the overall health picture. Interpreting lab trends is a proactive way to manage your health after cancer. It helps you stay informed and engaged in your follow-up care. By understanding your lab results, you can work with your healthcare team to support your ongoing recovery and wellness.